Hello, Goje, I'm here. Good morning. Goje. Hello.
Yes, Mr. Abel, we are with you.
Okay, good morning, Honorable Chairman. Good morning, my colleagues. I want to say good morning to every one of us. We are just multitasking, and apologies for that. The OGP steering committee is meeting at the moment, so I'm shuttling in between the two meetings, and apologies for the little delay in trying to connect to this. I want to thank the chairman for all the processes of LG reform that he has been leading in Lere local government area. We have 1,000 times told a number of other partners that are coming from outside Kaduna the reform that Lere local government area has been championing over the period the chairman came into. And Lere is actually a model of all the local government areas in Kaduna State. We are happy and always happy to join any issue that concerns Lere in Kaduna State, because Lere is a model OGP is being co-created at the state. Local government reform, yes, a number of things are happening there. Sharing your budget document and holding town hall meetings with citizens and so on and so forth. So again, this is the path to go in terms of governance and development. And a number of other states and local government area in Kaduna State may be willing to learn from you as the chairman of Lere local government area. We will not appreciate you enough than the connect between you and the citizens in Lere is the governance system you are delivering to them and ensuring that the citizens are part of your governance process in Lere and Kaduna State as a whole. So we thank you sincerely, and we'll continue to appreciate you for all the things that are going on in Lere local government area. And also thank CALPED and all the civil society groups that are working and the media to ensure that the citizens and government are working and then moving development forward in Nigeria. Thank you very much.
Yeah, thank you very much. Just quickly, I also noticed Mr. Joshua James would love you to also give us a good message. One of the partners that we facilitated the local government accountability.
Yeah, I think.
Mr. Joshua James, goodwill message, Open Kaduna.
Good morning, everybody. Open Kajuna Radio welcomes everyone to this Zoom webinar. We at Open Kaduna Radio want to commend the administration of Lere Local Govt for ensuring that OGP is practiced and implemented in the local government. Why the local government has not gotten to where it ought to be, but we at Open Kaduna believe sincerely that the local government has moved from where it was before to a place new. We commend the administration of the local government chairman, while we also commend CALPED, PERL, as well as Ground Zero for putting this Zoom webinar together. It once again defines that the media, civil society organization, development partners, and of course, the elected representatives from the government side are willing to ensure that good governance, especially at the local level, is entrenched, because this is the tier of government that is most closest to the people. Once again, thank you very much for putting this together, and I wish all of us a fruitful celebration. Thank you.
Thank you, Mr. Joshua James. These are some of our very strong partners that we've been working with to ensure that we also facilitate the local government accountability mechanism at the local government level. So quickly, the session we are going into is the discussion proper with the Executive Chairman of Lere Local Govt, Honorable Abubakar Uba, who has been a strong partner of the civil society in Kaduna State in terms of not just Lere Local Govt, but Kaduna State at large, because most of the reforms that civil societies have been pushing, he has always welcomed them and used Lere Local Govt as the first test ground is always the first in allowing these reforms to be tested. And it is usually the experience we get from Lere that we usually use to help us also reach out to other local governments. So it's a strong partner of the civil society. And we believe that with this conversation, we will see more areas of collaboration, especially within the local government in terms of what the council is doing and civil society organizations working within its local governments. A lot of people have left but are still joining us, but we'll still continue the conversation. So I welcome you, Executive Chairman of Lere Local Government.
Thank you so much, Yusuf.
Yes, the network today wanted to do opposition party, but by God's grace,
I would overcome it.
Yes. So quickly, because we don't want to waste your time, again, this is the Local Government Accountability Mechanism series. This is the first. By 3 p.m. we would also be doing with the local government chairman of Jema'a local government. Then we have other local governments that will take next week. Basically, what we want to know is looking at the theme of the discussion, which is COVID-19, local government response, recovery, and accountability mechanism. So we want to basically know how has COVID-19 affected your administration within the local government. Most of the time, attention is being paid at the national and state level, and nobody is talking about what the local governments are doing, and they remain the closest to the people. Even the government house is in a local government. So it means that anything we are doing in responding to, especially a huge challenge like the COVID-19 pandemic, we need to really bring to the limelight what the issues are in terms of local governments, what their challenges are, and what is the way forward in terms of solutions. But looking at all that, we'll look at the response and the recovery, but the local government accountability mechanism is important for us because globally we have observed that countries that are managing the pandemic better are countries that have effectively adhered to the principles of transparency, accountability, and citizens' engagement, which usually leads to citizens' ownership of the fight. Because government cannot do it alone, but once citizens are carried along, they will join government to ensure that the pandemic is addressed. So I know that I won't take much time introducing you because the first question is actually for you to introduce yourself so that people that don't know you will get to know you properly. So just tell us about yourself, sir, before we start the questions.
All right, thank you so much, Yusuf, and other participants. Good morning. My name is Abubakar Buba, the chairman of Lere Local Government Council. In brief.
So okay, that is very brief, sir. Thank you for that. Yes. So, but you wear many caps, but it is for another day. Since you say it is brief, we'll leave it brief. Yes. So, sir, the first question is COVID-19 is a new reality that governments at all levels are grappling to contain. How has it been in your local government, especially in terms of the challenges of enforcing preventive measures? How has it been around your administration? Because in Kaduna State, they have the governance continuity plan, which is now e-governance, that makes running administrative duties easier and virtually without compromising social distance. So I want to know some of the measures you've taken in adapting to COVID-19. Then especially revenue, because we know that over the years, look, I even pity local government chairmen when it comes to revenue because people expect so much, but by the time you pay salary and other remittances and deductions, you just have to be cooling people's temper because there will be no money to really do the kind of work you want. Then budget implementation and health facilities in your local government. So those are the areas of challenges we want to look out to hear from you, sir.
Okay. So virtually, Mr. Yusuf, you've succeeded in coining almost all the question in one.
Yes.
I'm going to do them bit by bit.
Okay.
But from what you said as the introduction and your last sentences, it's like you've almost coined everything to one. So invariably, you expect me to just continue speaking.
Yes, yes. Although we have some other questions, but it will be follow-up questions to that.
Okay.
Yeah.
Okay. Well, once again, good morning and thank you for having me among your midst. I'm happy to be here discussing with partners in progress on the issue of COVID-19, more especially how it affects my local government, which is Lere, and probably the experience that we shared with some of my colleagues that are in other local government as well. Like you said, COVID-19 is now a reality. We have to adapt or learn how to live with it. Because at first, it was like a scary monster that wanted to eliminate humanity. But now, thank God, we're able to come together globally to see how we'll be able to manage and live with the pandemic that is affecting or ravaging the entire globe at the moment. Like you said, the issue of COVID-19 took man unaware because nobody planned it, nobody saw it coming. It just came abruptly, and it actually affected most things in terms of governance as a whole, in terms of human life in general. Now we are narrowing it down to governance, how it's going to affect us, or how it has affected us, and then what we are putting in place to ensure that we have reduced the hardship that the COVID-19 has enforced on our people and in governance in general. But really, the disease came when we least expected it, and it really affected our mode of operation. Almost everything has to be on standstill. Not until the first 2-3 weeks was a scary moment. Later on, people started coming together to gather themselves and say, okay, what is the way forward? At the end of the day, today, we all believe that we have to live with the disease and come up with mechanisms that will make it a history or something that is not going to affect our day-to-day activities as humans. In Lere Local Govt, when we came, at first, there was an apathy of what is actually even COVID-19 from our citizens. Some believe that the disease exists, while others feel that no, it is just a mere scam. There is no any disease called COVID-19 because some people want to see someone physically that is affected and the way he's maybe going about, maybe they want to see it physical before believing. So that was the first challenge that was before us. Now we have to employ mechanisms in order to educate the citizens, to even tell them, to convince them that yes, this is reality. Because without them believing that the disease exists, there is no how you'll be able to sell anything to them for them to believe. So that was the first thing we had to do. Went for advocacy and a lot of talk shops with all the necessary relevant stakeholders that are within the local government, more especially the religious leaders, the youth organizations, civil society organizations, the traditional institutions, and the likes. All the stakeholders were brought together. We discussed with them, with the health facilitators within the local government. And we went about with a lot of radio jingles, and I featured in so many radio and television talk shops in order to sensitize the citizens that this is real. Thank God, with the help of other leaders around within the local government and the state, and what the media has done, because the media has done a lot towards sensitizing people for them to believe that this is a reality. So that was the first challenge we faced. But at the mercy of God, we're able to overcome that because at the moment, everybody believes and knows that yes, COVID-19 is real and it has come to stay with humanity for now. Basically, that was the first challenge that we experienced. But immediately after that, we had to swing into action. The first thing we did was to ensure that we set up the local government rapid response team of COVID-19, which we did, and all the relevant stakeholders were part and parcel of the COVID-19 task force of the local government. We are saddled with the responsibility of ensuring that after the sensitization, people are, the health workers, more especially, and religious leaders and the traditional institutions of the body are involved in ensuring that in any community, if there is any information, we should share it among ourselves so that action will be taken immediately. Then educating the people within the society to reduce issue of social distancing, to be using hand sanitizers or washing their hands where necessary, and then report immediately anybody that has any symptoms of unusual symptoms that may be connected to likely COVID-19, high fever, excessive catarrh, cough, and the likes. So we were able to do that, and at the same time, we thank the state government for the rapid response it took in Kaduna State by ensuring that people were asked to stay at home, and they were advised on what to do. That was one of the things that really assisted us to reduce community spread of the disease in Kaduna State. The local government, we have our own challenges, and part of it we were able to summon because, like I said, the assistance we got from the state government, because immediately the state government ordered a lockdown of the state to stop interstate movement. My local government have a boundary with about 3 states, which comprises of Plateau State, Kano State, and Bauchi State. So we had to swing into action immediately on that to collaborate with the security agencies, the health workers, and we, the staff of the local government, with other relevant stakeholders from the state to ensure that we stop the movement influx of people into the state through the borders with other states. Because the reason being that we supposed to ensure that we control what is inside without conceiving more from outside. That was the brain behind that by His Excellency Malam Nasir Ahmed El-Rufai, our amiable governor, which we really appreciate. That we did as a local government, and were able to man the various border points from other states. That assisted in reducing drastically the issue of the spread of COVID-19. As I speak with you, I think for now we don't have any record of COVID-19 in my local government, and we pray we'll continue to sustain that tempo, because we are doing our best to ensure that nobody is contacted, or even if there is, then the measures we took or that are on ground now, the rapid response team is still active, and our staff have been trained, the medical personnel have been trained, and they know what to do on time, and we are always in talk with all the relevant stakeholders to ensure that, yes, whatsoever is required for us to do, we do it, and so far so good. Issue of economy, and more especially the dwindling economic issue that we've been faced with before the COVID-19, and then what we're experiencing at the moment. Yes, really, before COVID-19, we've had some challenges with revenue, and especially after the increment of salary payment of minimum wage. As you know, Kaduna State is the first to implement, and the implementation is both at local and state level. So that has made us to really look inward to see how what we'll be able to do in order to improve on our own internally generated revenue, and then reduce unnecessary spending, so that we can save what can be saved, and so that we can continue to implement on the other aspect of the budget that we promise our citizens. At the midst of all this, when the COVID-19 struck, as we speak now, as you know, not just Lere Local Govt, Kaduna State, or Nigeria globally, down, and something that we are seriously working on at the moment. What we have now is look at after looking at the budget, we have to now start looking at how we are going to prioritize the issue of what do you call it, we prioritize in the budget issue that has to do with human development and capacity building, more especially of our youth and women, because at the moment the average per capita income of all the citizens is down. People are suffering because there is no money and the economy is not doing well. But what we feel that we should do as a post-COVID issue is to ensure that we improve on we build on the capacity and then improve on the welfare of our citizens by ensuring that we give them the necessary tools they require to be self-sufficient. That is, we look at human development more, like I said, by developing the human capacity to ensure that, yes, the women more especially and our youth are engaged in doing so many things that has to do with crafts, and then that will improve on the economy and it will go a long way in reducing the poverty rate within the local government. As you know also, Lere Local Government is an agrarian local government. More than 80% of the citizens of the local government are farmers. So we are capitalizing on this rainy season to ensure that all the necessary things we need to get for the farmers in order to secure a good farming season in place. As I speak with you now, we have a program running in the local government in conjunction with AGRA. They are giving the farmers improved seedlings to ensure that, yes, of maize, to ensure that the yield it's improved. We're able to come up with, we have 3 tractors in the local government. All of them have been put in place and fixed back to the land, and we've given them out to people so that that will assist them in the, cultivating the soil. At the same time, our partners that supply fertilizer to the local government, we're in touch with them. Even last week I was in their office, and so far so good. I think the number of trucks that is required to come to the local government are coming in, though we are not yet there, but we ensure that even on the Thursday, last week Thursday, they were able to supply like 5 trucks to the local government. At the moment, we have received about 8 trucks from them, and what the agreement we've reached with them is that on the average we'll be getting like 5 trucks in fortnightly, which is a bit fair. If that will be sustained, it will assist our farmers, because the fertilizer is sold at government controlled price of 5,000 naira. What we do in order to ensure that the people get the fertilizer and the fertilizer is not diverted is to ensure that, yes, the agri department and our stores where the fertilizers are kept have appropriate record of whatsoever is brought in, which will be signed off by so many people that is required. And then we set up a committee that have looked into the issue of the fertilizer distribution. Equally, we took the fertilizers, the first tranche we received, we send them to our various wards, because we have about 11 wards, in order to decentralize the sales and then reduce the hardship that our people may likely incur by coming down to the local government secretariat for them to have the fertilizer. Issue of revenue, like you know, like I've said, you need to generate before you think of receiving revenue. If you don't generate anything, you can't receive revenue. But with the aforementioned things I've said, improving the welfare of the people, and then assist youths and women to be self-sufficient, and then ensuring that our agricultural sector is doing well. With this, we'll be able to have more funds that will come into the government in terms of revenue generation. There are mechanisms we are putting in place to ensure that we revamp the revenue lines of the local government, and then the leakages that have been on to ensure that we've reduce as much as possible as we can. Now we have a new team with a new chairman of the revenue committee that were sworn in just before the advent of COVID-19. They came up with very good ideas, and we sat down, we shared the ideas together with them. Now, as a post-COVID, we will try and see the implementation of the process so that we can raise more funds in order to do other aspects of the budget as we promise our citizens. Thank you.
Okay, thank you very much, Mr. Chairman. I'm just tempted to just say the meeting is over, because you had practically covered most of the key questions that we wanted to put to you. But thank you very much for that extensive presentation. Just to say, I don't know, how has it been in terms of service delivery, looking at the fact that revenue is at its lowest level and salaries must be paid? Most local governments we are aware in Kaduna are practically running on deficit. After they pay salaries, they can't do anything. So we are just worried that how has COVID-19 affected service delivery in your local governments? Because we have the 2020 budget, and one of the critical things captured is the CDC, Community Development Charter, which prioritized citizens' needs are captured in the budget through that tool. So now that we have these issues, what happens to service delivery? Should we remove mind till next year? Or is the local government looking at other alternatives to ensure that service delivery is not, yes, it will be affected, but not to the level that people would not see developmental strides? As in Kaduna now, even with COVID-19, the state governor is building roads, he's doing flyovers, and we know that some of you at the local government level look up to him. So what about service delivery despite the challenge?
Well, thank you, Mr. Yusuf. Like you said, really the issue of COVID-19 has affected the service delivery in the local government. More especially the implementation of the 2020 budget is suffering a lot of setback at the moment. And with the dwindling revenue and the challenges that we are facing now of COVID-19, definitely that is going to affect the service deliverables of the local government, more especially that has to do with the capital expenditure of our revenue lines. But that notwithstanding, the citizens should have it at the back of their mind that we are doing our best and will continue to do our best to ensure that at least something is put on ground to show at the end of the day. But I know definitely from the indices we have at the moment, the deliverables may not be as good as that of 2019, but it's not going to be totally zero. What we are thinking of or putting in place now is to expand our partnership and support that we require from international donor organizations and maybe well-meaning people that will assist in one way or the other to assist the local government in achieving part of what we have promised our people. At the same time, even the state government, most of the projects that we feel we can beg and for state government to come in and partner with us for the implementation, we are working on that plan to ensure that at least we have something at the end of the day that before the year runs out, that will show to the citizens or people will believe that yes, we are not just sleeping or because we want to use COVID-19 as a cover not to do anything. Yes, we know we have shortened revenue lines, but that notwithstanding, it is time for us to think outside the box, fold our sleeves and work on waters to ensure that yes, we deliver what we need to deliver as a mandate given by our people. It's our responsibility. We are working on it and we'll continue to explore all possible areas that will make our people to be where they are supposed to be. And this I pose as a challenge, not just to myself, but to anyone, meaning citizens of Lere Local Government and friends of Lere Local Government, anywhere they feel that we can tap into and in order to get things right is highly welcome. And we continue to partner with everybody that is a friend to the local government to ensure that at least we bring succor to the citizens of the local government. Thank you.
All right, thank you very much. I know you've touched a bit around palliatives, but more than ever, the issues of social protection is coming to the limelight more and more with challenges like COVID-19. because COVID-19 has actually thrown a lot of people into poverty, into hunger, aside the health impact of the palliative. So what is the local government doing towards having a comprehensive social protection program in terms of palliatives and other empowerment initiatives? I know you've mentioned a few, but we know that going forward, we need to expand because Lere is also highly populated. As you've said, it's also a transit local government from a number of other states. So it means that people are coming in and out, people are coming in to settle down in Lere. So the population is growing larger. And if you look at the local government development plan, it says poverty rate in the local government is very high, even though you have argued about it one time. But assuming that it is still less, even if it's 60 or 50%, it is still high. So what are you doing in terms of palliatives? And what have you also observed with the palliative distribution carried by the state government? Because I know the state government also did something in that regard. So I want to hear your views about that of the state government. Is there any plan for the local government council to also carry out such social protection intervention? Okay, seems the chairman mute his mic. Okay, you muted your mic, now, sir. Yes, sir.
Am I okay now?
Yes, we can hear you.
I said, really, like you said, actually, the issue of social protection of the citizens is very, very key. And the COVID-19 came with its own odds. Part of the odds is at the moment, the poverty figures have risen. A lot of people that have small-scale businesses are now down because for the period of lockdown, the small capital that they have been consumed by them and their families. And at the moment, this is a very red signal to any right-thinking leader. That was the reason why we said, as we are going to give priority to issue of social intervention in the budget, because all the social intervention lines that we have in our 2020 budget, we've withdrawn them and brought them forward, because now what we need to do is to ensure that at least we empower people back, no matter how little it is. More especially, like I said, the youth and women, because they are very, very critical in the society. What we have in the budget, we have a lot of lines that has to do with provision of goods and goods that will assist our youth and women to be self-sufficient. So we will intensify training of the youth and women in order to come up we'll try as much as possible to make our women and our youth to learn trade that will assist them. And then come up with issues that will assist, so that at the end of the day, people will be self-sufficient. Like maybe you have a distribution of materials that will assist them to be like the trade, improve issues, maybe for the youth, those that are into welding, those that would be into furniture making, those that would be in the sewing machines and what have you not. We get them and then distribute to the people, so that this can at least reduce the hardship of the people. In terms of issue of palliative, yes, there was a palliative distribution in Lere Local Govt, and the state handles the distribution. But there are some few challenges that were mentioned during the distribution. I think there wasn't much consultation, and most of the relevant stakeholders that need to be consulted before the distribution were not. So the distribution was a bit lopsided. That has really affected the issue of the distribution. But this we've noted, and the necessary measures have been advised, and pretty much sure the mistakes will be corrected in future if such issue will come up again. Thank you.
All right. Thank you very much for that information. And I must also say that Babangida, who is also going to be sharing his experience with us later on, also with other partners in the Lere Local Govt, also shared the same information you've just been given in terms of the state palliative distribution. And we hope that this will be an advocacy platform, this program we are doing, for all of us to ensure that we reach out to the government so that going forward, any palliative distribution must be done with a multi-stakeholders approach, where everybody that is a stakeholder must be involved and carried along, so that we ensure that it is the poor and really vulnerable people that benefit. Just quickly, sir, we know that in terms of data, information, no government can plan effectively if you don't have data. And we know that even within the local governments, data collection sources are available. For example, our primary healthcare centers should be able to generate some level of data and what have you. So what role has data played in your planning, in the planning around all these steps that you're talking about? For example, we were also talking about agri-intervention. Was there any data to show that, okay, this is the number of people that need it and all that? So that, because targeting is very important in government interventions to ensure that it is the right people that need government intervention that are getting it. So how have you, first of all, is there data for you to do that planning? If you have sources of data, how have you been using them to inform your decisions in response to COVID-19?
Well, thank you so much, Yusuf. Yes, if there's no, if you can't have a proper implementation of any plan if you don't have sufficient data to back it up. Because data is the backbone of all plans that needs to be implemented. Thank God, when we came in, we discovered that the state government has done a lot, and quite a lot, through our Ministry for Budget and Planning. The Statistics Department has almost covered a lot of data capture within the 23 local governments in the state, in the various fields of human endeavor, education, health, social, and other aspects. This we leverage on because we normally share our findings with what the state have collected, and looking at possibilities of the updating of the data in order to ensure that whatsoever we are doing, we are on track. We normally use the data source from what we have from Bureau of Statistics, from the state government. At local government level, we don't have much of the technical aspect of data collection. So we normally depend on the data we get from the state government. But at any point in time, the state government wants to, or we feel that the state government needs to improve, or we want to get that information, we get in touch with them. They send their officials to the local government. They work together with our own people in order to get the data that is required for us to have or do any planning of what we want to achieve. At the moment, I would say we have a very good statistics of in terms of the education, that is enrollment of pupils within the local government, the number of teachers that we have, the number of schools that are in the local government. At the same time, in terms of health, we have a good number of data, because we know the number of health facilities that we have in the local government, the number of staff, and then we know the enrollment of, more especially, women that come for antenatal and postnatal in the clinics, compared to the population of people that are living within the preview of the PHC center that is around the area. So that will assist us to know where we need to do more especially if people are coming, especially for the women are coming for the antenatal program, how many percentage are there, how many are not there, and what do we need to do in order to ensure that we bring in more women coming to the health facility. That is just an example I'm giving of health. Now, what we are faced with is issue of post-COVID-19. What we are looking at more is this COVID-19 has shown us a lot of our lapses. Part of it is in the area of health. We've seen that our health system is almost close to nothing because not at the local government or state, even at federal level, we discovered that as a country that we have a lot of lapses health-wise, because this is just like a litmus test that came to us. And in terms of rating, I would say we did not get it right. We need to go back to our drawing board and ensure that issue of health, more especially at the primary level, that's primary health care, is improved, which that one is saddled at the local government level, because this is the first step towards ensuring that health issue is being controlled or gotten right at all levels. This is really helping us and will ensure that we capitalize on the figures we have, and then the mistakes that or lapses that the government has faced in terms of health and other sectors when it comes to issue of even distribution of this issue, the things that has to go to the local government or the various ward or the various villages that is required. For instance, now, if we have a population on an average, okay, let's say 2,000 households to a PHC clinic, how many do we have? Are they evenly distributed among within the communities? What's the population of such a community? So this is really going a long way in giving us the leeway in order to have or know what we need to plan, so that we can plan it right and get it right. So far, so good. We are not yet there in terms of that, but God's willing, we will, because the civil society organizations within the local government are really assisting in terms of that, because any information they have on such, they really share it with us, and we take it up in order to ensure that at least we get what we need to get right for the people. Major challenge we are having or facing at the moment is issue of dwindling revenue lines. The funds are not there, but the planning is there. As soon as we get the funding from whatever source, we will ensure that we continue the implementation as it should be done right. Thank you.
Thank you very much, Honorable Chairman. I want to still hold on to the last issue you talked about, which is revenue, because revenue is like the blood of any government. Without revenue, the government is in trouble. So importantly is that what reforms do you think we need to put in place, be it at the state level and at the local government level, to ensure that the revenue base within the local government is tapped into? Because Lere Local Govt is one of the biggest corn market in West Africa. Apart from other products that we have not quantified the output that is coming from Lere. I know that sugarcane is also another major agricultural product that Lere is blessed with. So looking at this, what reforms do you think we should put in place, especially one, if you look at the laws within the local governments, there are certain penalties or fines or levies that, if you look at the amount, is actually laughable. Looking at most of these laws, bylaws were set many years ago when the Naira was still having value. So what reforms are you suggesting? Then we also know that the Auditor General's report, for example, in 2018, said that about 1.5 billion or so was not remitted by the state government to local governments. So what reforms do you think that all these issues of local state is generating revenue and local government is not getting the right amount that it should be getting. So we just want to hear your own ideas around that.
Well, thank you so much. I know there were discussions that was done between local government and state government in terms of issue of how to improve the revenue in local government level. And what we all agree upon at the moment is that the revenues that are due to the local government should go back and ensure that all the necessary things they need to put in place to get the revenues is gotten, because this will help in ensuring that the revenue figures of the local government has improved. Thank God, like I said, we have a new team of revenue committee in the local government, and they came with a zeal to really work. What slowed them after the inauguration was this issue of COVID that we experienced. But now that we are in post-COVID issue, all the good efforts and then plans that they have in place and they submitted to us, we follow it with action immediately. Like you said, we have Lere Local Government. Our major area of strength is agriculture, and we have crops that we are leading in terms of production of such crops, and not let me just say the state, or almost there, like I will say in the country, like issue of maize, issue of sugarcane that you said, even vegetables now, because during the dry season farming now, you see the number of vegetables that is being cultivated in the local government is very, very encouraging. We equally have soya beans, we have millets and the likes. We are very good in grain production. So what we intend to do at the moment is that the revenue, because prior to now, or even as at now, we operate in a unified revenue system in Kaduna State, and the companies that were employed to be in charge of the revenue collection in conjunction with the local government revenue team are doing their best. But there are a lot of lapses that are there, and we're able to come up and pinpoint the lapses that we've experienced so far with them. And we've given that to the state government. That has been looked into. I'm pretty much sure any moment from now we'll have a better way of doing it, because the synergy needs to be more in order for us to get the revenues right. This will continue the discussion, and then so far what we have in place, the implementation, in order to have the revenue figures go up so that we can do so many other things for the citizens of the local government. Thank you.
Okay, thank you very much. We are gradually winding down with my own questions. After I wind down, we give the two civil society actors that are working in the radio opportunity to also share their experience on the response of COVID-19, the recovery plan, and the local government accountability mechanism. How has COVID-19 affected that? So, but back to my question, I want to bring us around the key governance reforms that is ongoing in your local government, like other local governments too, around implementation of the local government development plan, the issue of the budget process, the CDC process, and lifters. We just want to know, how has COVID-19 affected those reforms? Are those reforms still being, are they still priority to the local governments? And when I talk about the reforms, I'm particularly talking about transparency, accountability, and citizens' engagement. Although for citizens' engagement, it will be a bit difficult because of social distance and what have you. But what is the local government doing to ensure that these reforms are not eroded because of the challenges posed by COVID-19?
Well, thank you so much. Issue of transparency and open governance is a priority, top priority to Lere Local Government, and it will continue to be. It's not something that we started to leave, and it's not something that we started to end at the end of my administration. What we want is the sustainability of the entire process, and that is the reason why you notice the engagement of the citizens and civil society organizations and all the stakeholders is still on. I'm pretty much sure that's the reason why here, as you invited me, you equally invited members of the CDC and then maybe the civil society organization to share their own views in respect to that as well. What we are trying to build is something that will stand the test of time, not just because we have passion for it or we feel that that is the in thing in terms of if you want to be part of the global community today, you must go, you must do this, you must do that. No, we believe in the cause. The cause has come to stay, and we want to make it as an institution in the local government, not just something that will come and then go with the administration. It should be something that should continue. As I speak with you now, the interesting part of it is that if you go to social media and see how people are engaging us in terms
This
of
is my pee-pee. This is my pee-pee. This is my
you will be
pee-pee.
very, very much surprised.
Niggas in my boat, oh niggas and niggas in my boat, oh niggas in my boat, oh niggas in my boat, oh niggas
Okay.
and
Hello.
niggas in my boat, oh.
Hello. So, like I said, it's something that has come to stay, because if you go to social media and see how people are
This is
engaging
my
us on things that have to do
pee-pee.
with
This
them,
is my
you're very much surprised.
pee-pee.
And
This
these
is
Hello,
my
are very,
Chairman.
very much
pee-pee.
interesting.
This
Yes, I'm
is
with you.
my pee-pee.
Somebody has hacked the
This is
Zoom
my
platform. They are
pee-pee. This
sharing
is my
funny videos.
pee-pee. This
So
is
Exactly.
our team would work on that.
Niggas in my boat, oh niggas in my boat, oh niggas and in my boat, oh niggas in my boat, oh niggas
Our
and
team will work on it.
niggas in my boat, oh niggas in my boat, oh niggas in my boat, oh niggas and niggas in my boat, oh niggas in my boat, oh niggas in my boat, oh niggas and niggas in my boat, oh.
So this is what we are seeing with Zoom meetings these days. They are
Niggas in my
usually
boat, oh niggas in my boat, oh niggas and niggas in my boat, oh. Niggas in my boat, oh niggas in my boat, oh niggas and niggas in my boat, oh niggas in my boat, oh niggas in my boat, oh niggas and niggas in my boat, oh niggas in my boat, oh niggas in my boat, oh niggas and niggas in my boat, oh.
yeah, we are working on it. We'll soon do it.
Niggas in my boat, oh niggas in my boat, oh niggas and niggas in my boat, oh niggas in my boat, oh niggas in my boat, oh niggas and niggas in my boat, oh.
Sorry everyone, I think the situation is
الشعب السوري بالساحات للمجد بيرفع رايات عم يهتف بثلاث كلمات الله وسوريا وبشار كنيسة وجامع متحدين والمحط عنوان الدين وملايين السوريين وما بدهن الا بشار.
okay. Can we continue? I think we're safer now.
Okay, thank you. So, am I still on?
Yes, Chairman, you are still on.
Thank you so much. So, like I was saying, what we want to build is something that is sustainable. We're not thinking of just having issue of open governance, good governance to last the long of this administration alone. It's something that should last the test of time. Like I said, I'm very much happy if you see the way we are being engaged by the citizens of the local government through different platforms on social media and even on personal level. It's a very, very encouraging issue. Because prior to now, I know people it's just what they want you to get is what you get. But people now know what the government is supposed to do for them. They are part and parcel of what governance is. And if they see you not doing what you are supposed to do, they engage you and even criticize on the issues if it is not done right. So this has made me to be very happy, and I think we have started getting it right. And God's willing, I'm sure anybody that is coming even after us will be left with no option other than to do what the people want. If not, the people will take the challenge upon themselves. It's a challenge to the civil society organizations. It's a challenge to all stakeholders within the local government to ensure that this has come to stay. We have the will and the zeal, and we're working on it. And so far, what we have on ground in terms of the even participation of the civil society organization and people from the side of government as the working committee, it's really, really important, and it's really, really working. They checkmate each other, and this will surely be sustained by the grace of God. Thank you.
Thank you very much, Honorable Chairman. Yusuf Goje is still trying to find his way back into the meeting.
Okay.
If you permit me, now I will ask Babangida Garba Lere to share with us some of the experiences from the side of civil society on issues that relate to accountability mechanism, service delivery during the COVID-19 period. Sorry again, it's raining in my own location. So, Babangida, please unmute your mic.
Hello, can you hear me all?
Yes, go on, Babangida, we can hear you.
Okay, thank you. So, Mr. Chairman, welcome. We're happy to have you in our midst. So, I would like to say something much special about this palliative distribution in Lere Local Govt. So, as you said earlier, yes, it's true that I even went there and I learned that there is nothing like stakeholders that are there present purposely to distribute these palliatives. Honestly, they didn't involve any stakeholders, be it chairman and rest of the traditional council and others. So I heard that you said that you are preparing for this, palliative distribution or something of that nature. Anyway, I would like to know either when and the criteria you follow in selecting those people, the most vulnerable people in our localities in Lere Local Govt. And secondly, about the issue of still about the issue of this COVID-19, the reopening of schools. We had that SS3 student, JS3 student, and primary 6 students are to resume, but we don't know the date that we are going to resume. So, what preparation? What have you prepared on to see that this primary 6 students observe this social distancing and they were well secured in the school and the teachers themselves too. So, thirdly, about the issue of this fertilizer, because we are in the rainy season and we know that in the local government we are mostly farmers, and the high rate of the high cost of this fertilizer this year, is going out of hand, honestly. So, and those small scale farmers are finding it difficult to have access to this fertilizer. How can a common man get an allocation to have or to purchase a fertilizer from you, Mr. Chairman?
All right, thank you, Babangida. Do I have the floor now?
Pardon?
I'm asking the moderator. Do I have the floor now to respond?
Yes, you can explain, sir.
Yes, you have the floor to respond.
Okay.
They are
All right.
panelists, but after this, you are the guest speaker. You are obliged to.
All right, thank you. We did a brilliant observation and question. issue of the palliative, like you said, is not. I didn't mention that we are going to redistribute palliatives now. I said if going forward, either the state government or anybody wants to come and distribute palliative in the local government, we will ensure that all the necessary stakeholders are in place and do what they are supposed to do. The consultation will be widened, and so that we'll get it right. Issue of fertilizer. Well, that one we are like I said during my opening remark. At the moment, the fertilizer we are getting from the state government is coming in batches, and as it comes in, that is how we distribute it. We have local ward committees. Like the first batch that we receive, I know the first one we receive. They gave us one trailer first. In the first trailer that they gave us, out of it, we distributed about for each ward. We distribute about 60 back per ward. That one we said it should be done as an open sale, more especially for the lower cadre farmers that will require 2-3 bags should be the area of concentration, because most of them, if we said we are going to tell them to come to Saminaka to get the fertilizer, it may be a problem on them because transporting and what have you not will equally be a problem. And having known the price of fertilizer in the market at the moment, I know there are a lot of pressure on the issue of fertilizer now, because in the market, the one that is not government controlled, there is one that is selling as high as 10,000 naira. If you compare that to what the government price is, which is 10,000, you know definitely there is a lot of pressure on the issue of the fertilizer. But the local government, what we are putting in place is to ensure that at the end of the day, come what may, whatsoever we have in the end farmer should be the person that will receive the end result, because that is the essence of subsidy that the government has placed on the product. This we are so that we get it right. Issue of opening school, that one is something that is going to be uniformly done. It's not just going to be its local government will be allowed to say go and do this, go and do that. It will be communicated to everybody to know. And for issue of social distance, that's why we come in. As you know, it's only in secondary schools. It's only students of that will be writing their junior secondary school then those that will be writing their senior secondary school that will be allowed to resume back to school. In the primary, it's only those that are in primary 6 that will be graduating to junior secondary school.
Don't let your house
so as a result of this, for those that are in junior secondary school, if they come, we are not going to utilize just their classrooms. We are going to utilize all the at the same time with the senior secondary school. We are going to utilize all the classrooms that are available in the school within that. At the same time with the primary school pupils that are giving primary to junior secondary school. So we will not allow them to everybody to be in his class. No, we will distribute them so that we ensure that there is social distancing among them. And at the same time, for the teachers and the staff, before the reopening, we will ensure that we are, at least if for nothing, have some of the basic needs that they require before the schools are reopened back. Has to do with ensure that everybody that's coming must have his own face mask on. We will have running water and soap that we'll be using to wash their hands. We'll ensure that the place is well secured, and then probably any point in time, what they will go, they only go immediately after the academics. Everybody will go back to his home and then come back the next day. There won't be room for other things that will allow them to be coming together to violate the issue of social distance. So these are the little things I think we put in place for now. And once the date is ready, it will be communicated to all so that the students will go back to classes and take their exams as appropriate. Yeah, I'm done.
Thank you so much, Honorable Chairman. Madam Ladi Bonat is she is also in society. there in Lere. We'll want her to share with us on any of the issues of accountability.
Okay, Mr. Chairman, thank you very much.
Ayo, come. I want to talk. Come and link me. Hello.
Hello, Master Daddy. We're on
Hello.
with you.
We can hear you.
Yes, Ms. Ladi Bonnet, go on.
Yeah. Good afternoon, all.
Good afternoon, ma.
Sorry for. Hello.
We can hear you. Go ahead,
All right.
ma.
So I'm very sorry for coming late, but I've had part of the discussion. Mr. Abbas asked me to talk about accountability mechanism. Before now, there was no any partnership between the civil society organization with the government. So I want to thank our partners who deem it fit to involve the community-based organization into governance. So before now, we have been working in communities, but there was nothing like, the government hearing the citizen side. But with the intervention of so many organizations like LEAD, PERL, they empower us with knowledge to enable us to interface with the government. There was we have, before the local government election, we were able to, had a program with the present chairman where he talked about collaborating with the civil society organization, and which he really, engage us in most of his activities. So the PERL and LEAD empower us, and he was able to, whatever the civil society organization is doing, there is this understanding between the civil society organization and the local government, and both the civil society organization and the key officers at the local government level, like the head of department, we were trained on so many issues that talk about accountability at the local government. That is why so many committees were formed in agreement with the chairman. We have the local government technical committee where we monitor most of the projects executed by the local government. And we also have the local government education committee where they also talk about, we have a time frame where most of the activities that committee does is based on the time frame. Then we also have the health committee at the local government. These are some of the activities that is gearing towards local government accountability. Then we also have the CDC, which is the Community Charter Development, where before budget formulation, we have the Community Charter Champion, where they go from one community to another, discussing or trying to get their community needs, which will be captured in the local government level. And when these needs are captured in the CDC, we usually come and harmonize the community needs for formulation of the local government budget. Then the chairman also talked about ensuring the women and youth are being, they are being engaged in most of the programs. Yes, I remembered, there are so many programs that is gearing towards that, to ensure that the youth and the women when they are engaged, they'll be able to, they empower them, and they'll be able to be self-sufficient in most of the things they do. Then, in terms of keeping records at the local government level, quite all right. The program has really made the local government officers to sit up in terms of record keeping. Before now, when you are looking for something, they will say it is with this person, the next person. Before you know it, you'll be tired of getting information. But with this, at least, when you are looking for something, the officers, because of the interface we have been having with them, they will not hesitate in giving you most of the information. Then the issue of the palliative. I know when this palliative was given, I was called upon, but unfortunately, most of the key stakeholders were not involved in the giving of this palliative. And we have been having series of engagement with the chairman about what plans he has after this COVID-19. He talked about the local government and agricultural area. He will pay more attention on fertilizer, farm input, where some organizations are already in Lere to ensure that farmers are being helped to boost our agriculture. I think these are some of the few things I can say about accountability mechanism at the local government. Thank you. Hello? Hello?
We can hear you, Madam Lere Bonat. I was trying to share the action plan for the accountability mechanism technical working group of Lere Local Govt. I would like to ask Madam Lere Bonat, with the critical role around mobilizing citizens and some of the things the chairman has said around trying to
Hello? Hello?
Yeah, I can hear you. I hope you are following. I said with the efforts of the local government council in sensitizing citizens, ensuring that COVID-19 is really, challenges around COVID-19 is well mitigated. What critical role of this local government accountability mechanism, the citizens component, really been able to supporting the local government achieve all of the objectives that it has now, having a zero case on COVID-19 already?
Thank you very much. I think, hello?
Yes.
Hello? Are you hearing me?
Yes, I can
Hello?
hear you loud and
Yes,
All
yes,
right.
we can hear you, we can hear you.
I think the chairman has already said, but in terms of citizen participation, we have been having a lot of sensitization to our community members on COVID-19. Everything around COVID-19, the contact, prevention, and the rest. And we talk about empowering the security agencies to ensure that people don't come into the local government without being checked their temperature at the border level. Then he also talked about empowering the health personnel, along with the civil society organization to do much about, to do sensitization from community to community on COVID-19. Then he also talked about, people being an agricultural area, people, whatever people do, they should ensure that, the social distance is maintained to avoid being infected or contract the COVID-19. Then on the part of the civil society organization, we are very much aware of most of his programs and policies, but I want to stress, that he needs to do more in strengthening the civil society organization to perform their duty, more especially at the committee level. I know that before the COVID-19, we had the local technical working committee, where we had our action plan, to do sensitization in the area of citizen participation. Because before now, citizen doesn't have a voice in governance. But we thank God with these policies of policy around citizen participation in governance. Citizens are really much, aware that their voices need to be heard at the local government level. So I want to, request the local government chairman to strengthen these various committees so that they can do their work effectively. I'm very happy, in terms of accountability. For now, the local government will be able to tell you the number of primary schools we have at the local government, and also their deplorable condition. So the education committee also works around that area, which before now, the local government chairman was able to do a lot of projects in most of the wards, which it was shared to civil society organization during one of the town hall meetings that gave us that assignment to go and verify whether those things he said he has done are really on ground. And with the local government development committee, we also want to ensure that whatever is at the local government development plan is being executed by the local government chairman. So I will seize this opportunity to let the chairman, know that you need to strengthen those committees, because whatever one is doing, with this present program, we need to be accountable. So in being accountable, we need to monitor, we need to sit down and talk at the various committee level. What are the challenges the society organization are facing in monitoring most of the projects, and then the way forward, where we need to strengthen, where we need to amend, all these things. If we don't sit down, the civil society organization don't sit down with the chairman, it will be very difficult for for us to agreed on certain things. He has been doing a lot, because he has given the civil society organization, his door is open. His door is open. But at times when we want to sit down with those officers at the local government, the head of various head, they will, at times we don't find it easy. They'll be engaged in one thing or the other. But based on our work plan, I think if the chairman can go through our submission, he'll be able to know when we'll be having a program. Even if they want to, even if those head of department wants to dodge, it will be very difficult for them to abscond in some of the things we are doing. Thank you very much. Hello?
Hello, ma.
Yes, yes.
Are you done?
Danjuma just lost connection. Thank you so much, Ladi. Let's now invite Joshua James. He is going to make some contributions. Joshua James, over to you.
But sorry, Master Ace, before you engage Joshua, can I say something?
Yes, please. Yes, please.
No, I have another engagement and I selected for 12 immediately after this program, and it's like it's taking me beyond that 12 now. I don't know if the house won't be unhappy if I beg to take my leave now. I don't know if
okay. Okay, it's important that you must go to the other meeting, and we appreciate your coming. Danjuma Abbas Dangwa was to make some comments. If you just give us just 3 minutes, Chairman,
no,
just give us 3 minutes and we'll take it around.
It's okay, it's all right.
James, quickly, let's have your, see if you can wrap it up in 2 minutes. Joshua James, are you with us? Joshua James. Yakubu, I understand you have a comment. Yakubu, quickly make your comment. Meanwhile, Ladi, mute back your microphone. Yakubu Luka.
Yes, sir. I just really want to have a question for the chairman, please.
Yes, please, go ahead, quickly.
Yeah, Mr. Chairman, I want to really compliment you for all the efforts and all that you have been doing in the local government. The issue of the fertilizer, I don't know how you are going to cope with the marketers. Some of the times we used to have some of those challenges. When the distribution of the fertilizer, the marketers will go on buying the fertilizers and taking them to the market, sell it with an exuberant prices to the farmers. Please, I don't know how is the chairman going to really take control of that situation, please. Thank you.
And still, can I ask some question, please?
For now, we would want the chairman to just quickly wrap up. He has another meeting. So, chairman, just quickly attend to Yakubu Luka's question. Thank you, sir.
Okay.
Issue of sales of fertilizer, going back to the marketers to sell. I think this is a citizen. It's something that has to do with citizens' engagement as well, and we need to protect ourselves.
Did you hear me speaking?
Because the government is trying its best to ensure that they sell it to the farmers directly at a subsidized rate of 5,000 naira per bag. But to our dismay, sometimes you will discover that the same people that are given the fertilizer as for them to go and put it in their farm, some of them will add 1,000 or 2,000 to go and sell it to the outside market. So these are issues that part of the challenges that we have experienced or we were able to notice as far as this issue is concerned. And the approach we are taking in order to ensure this is we have to continue to let the people know that what this thing is meant for is for them to utilize, not just because today you need 1,000 or 2,000 naira extra per bag of whatsoever is given to you. You collect it, you pay, and you go back to the market and sell, because it will still come back to you. You sell it, they give you at 5,000, you sell it at 7,000, you come back and buy it at 9,000. So at the end of the day, you will discover that the issue of what the government wants to achieve, if it is not properly harnessed, may likely have a problem. That was the reason we decided to say, okay, let's go for decentralization and go down to the ward level and then do open sale, so that this will assist the people to ensure that yes, the real person that's supposed to buy the goods is the person that has gone to buy the goods. So this round tripping is still the citizens that are involved in it. So it is our collective responsibility, both as government, civil society organization, and all the stakeholders, to continue sensitizing people and show them the effect and danger of what they are doing. You know, human beings, you can't really say you have control over whatsoever everyone is doing 100%, but we'll continue to do our best to ensure that this is minimized. Thank you.
Thank you very much, Honorable Chairman. From everything we have discussed today, it is quite clear that there are opportunities and need for citizens to help local government in mobilizing, engaging, and ensuring that governance continues seamlessly. I have had reasons to keep wanting to take us to that document, the technical working group document, where in fact citizens and government are trying to say they work together in Lere to improve up to 2 new sources of revenue annually. I think if these commitments and other issues in that technical working group document in terms of their action plan is pursued vigorously, perhaps the recovery for Lere local government will be quite timely. But that will not be outside that kind of commitment where you carry them along like you did during the Open Government Partnership exercises in time past, the budget town hall meetings, so that even with the COVID-19 pandemic, your local government is able to respond and recover quickly, owing to the fact that there is that trust and mutual understanding citizens groups. So thank you so much for your time. So we want you to encourage them and drop them a word of commitment that that action plan will be pursued vigorously even now in the face of the pandemic.
Well, thank you so much, Madam Ladi, and other speakers that have spoken. I've noted the issue that you raised, continued engagement of technical working group and giving them the necessary support that they require. Definitely, this is part and parcel of our mandate, it's part and parcel of our promise to both of you and even the citizen of the local government. We will not relent on our effort on this, we will do more. It's a wake-up call. We will ensure that, yes, we put all the necessary mechanisms in place in order to be where we are supposed to be. Once again, thank you so much for your time. I really appreciate this opportunity for us to have the little discourse that we are able to discuss issues. I've learned so much, and I've gotten directly contact with the people that before now maybe it's been a while during this COVID we were unable to see, and all what we've discussed here has been noted, and at our own part will ensure that we put the necessary correction wherever needed in order to continue engaging our citizens to get things right as we promised them. Thank you once again.
Thank you so much, Mr. Honorable Abubakar Buba. You have actually been an icon for as a partner. As we understand, you are exiting the meeting in this meeting. Thank you, Estefanos. You have stayed with us till the very end of this engagement.
Thank you, Martin.
Let's just put a word or two as we begin to close this meeting.
All right. Thank you, everyone. I don't have much to say. It's indeed grateful to hear the chairman and some of the successes Madam Ladi mentioned in terms of how the local government is carrying the accountability mechanism along is indeed wonderful. This shows us that some of these platforms will be sustainable, and they will continue to engage, and service delivery will be provided to the citizens. Thank you very much, and thank you everyone for being in the meeting.
Thank you so much, Estefanos. Hisabon, do you have something to share with us?
Yes, I just want to tell the chairman that indeed we appreciate you having time to be here, the patience you had been with us for the past 2 hours, and all of that. And to assure you that on our part as a media, we will keep giving you the opportunity to tell the world the good things that is coming from Lere. And of course, if there are some bad things, we are sure you are also going to tell you. Mr. Chairman, we sincerely appreciate you. Thank you so much.
Thank you very much, Mr. Chairman. Just like they said, Stephanos had already said message on behalf of PERL. I've been shuttling actually in between two meetings. The steering committee meeting of OGP is holding right now and about to end, and this one is about to end too. Just like every other person has said, PERL will always continue to provide technical support, like every one of our colleagues have said. Thank you so very much, and we will continue to showcase what Lere local government area is doing. Thank you so much.
Thank you once again. I really appreciate as well.
Thank you so much. At this juncture, we will be closing the meeting. We thank everyone who has taken the time to be here. Let the conversation continue. Lere Local Government House is on Twitter. Lere Local Government is on Facebook. In fact, they were the first at that. They have a website where they are uploading information that have to do with governance. I would just urge citizens to continue to do so, to engage this information and even ask for more information so that there is the seamlessness in ensuring that service is truly delivered to the people. We as partners in this regards are very proud to be associated with the strides that is happening in the and we wish all of us a pleasant weekend as we begin to exit the Jumat Mubarak and Jumat Karim to all of us. Bye-bye.
Thank you so much.
Thank you for having me.
We thank you very much for your support, PERL, CALPED, and other organizations. We thank you very much.
Thank you, Babangida.
Thank you, Smith Wire, Godwin Kumai, Nuruddin Mukhtar, everybody. Thank you. Godwin Kumai, sorry, unfortunately, we couldn't take your comment. Sorry, we couldn't take your comment. So I'm sure by 3 o'clock, when we meet with the Kajuru Local Govt chairman for their own scorecard, I'm sure you would have the opportunity of also adding your voice. Thank you.
Okay, thank you very much. Bye-bye.
Bye.